Thank you all for being here. This is Delphi's second Insight session, and we're so thrilled to have Dr. Tyler Norris with us to have a conversation that builds on our introduction of Delphi's work at the intersection of psychedelics and the incumbent systems of healthcare, finance, and government. And we're also joined today by Floris Wolswijk, who is the founder of Blossom and also a senior research and policy partner here at Delphi. And for those of you who may not be aware of the Blossom platform, it serves as the leading data platform for the psychedelic industry, which translates complex research into actionable insights and clinical implementation of psychedelic-assisted therapy. Floris is based in the Netherlands and has also co-founded Flow Coaching with his wife, Lotte. So they provide psychedelic-assisted coaching with a focus on preparation and integration. And as a core team member of Delphi, Floris advises organizations within the psychedelic ecosystem and also the incumbent systems that we've mentioned, government, healthcare, and finance, focusing on the medical introduction of these medicines into the US and European healthcare systems. And I'm so grateful to have Floris as a partner for these many years at Delphi. And Floris and I are so thrilled to have an opportunity to converse with Tyler Norris, who is the co-founder and director of the CEO Alliance for Mental Health. Tyler brings over 4 decades of experience as a social entrepreneur and trusted advisor to philanthropies, partnerships, and government agencies focused on improving well-being and systems change for human flourishing. As the founding CEO of the Wellbeing Trust and a current senior advisor to organizations such as MAPS and the Psychedelic Science Funders Collaborative, Tyler offers a unique perspective on building sustainable mental health initiatives. Tyler operates in a key bridge role for psychedelics. And again, he is the ideal person to help us explore how psychedelic therapies fit within the broader mental health transformation and to discuss the strategic approaches that we can use for creating lasting system change. You can learn more about Tyler and his work at tylernorris.com, and we definitely encourage everyone to do that. And with that introduction, I will turn this over to you, Tyler. Thank you.
Thank you, Leah, for a beautiful opening, and so good to be here with you and Floris today, and those that have gathered for this call. Been looking forward to this for a bit. Floris, we only met recently, but I've been really inspired by your work and really looking forward to engaging with you and Leah, I think over the last 6 to 7 years in various areas. We've both been working, particularly in that, as you described, the incumbent mainstream mental health and well-being field, and have had a number of chances in different ways to be able to work with you. I'm just so thrilled about what Delphi is doing and really curious about learning more about Delphi and some of the opportunities, which is really at the heart of this call. Just to provide a bit of context, in my current role with the CEO Alliance for Mental Health, which gathers the CEOs of the nation's leading mental health organizations, for example, American Psychiatric Association, Psychological Association, social workers, NAMI, Mental Health America, and some of the big funders, we've been really focused on making sure that people have access to mental health care in the first place and that it's paid for with parity and that people have access to care. And increasingly, as these novel therapies have emerged back onto the scene with incredibly promising research, there is a real readiness and ripeness, I think, of the incumbent field to engage, and in some cases to let current research and education perhaps evolve their positions and their readiness to be ready for rescheduling and to take advantage of what's happening in the States. And it's incredible to see Delphi at the kind of front edge of what that looks like. Perhaps that's a good place to jump in to the dialogue here, and this could be for both of you, but maybe Leah, you can begin. You've been at Delphi working somewhat quietly for a couple of years. I know some folks have watched what you've been doing and listening and learning and building in the field, building on what others have not been focused on. And you finally revealed some bigger projects that you're working on. What would you tell us about some of the things you're most proud about in your work so far under the Delphi banner?
Oh, thank you so much for that question, Tyler. I would say that the things that I am most proud of, number one, our collaborative mindset. So in a field, in an emerging industry, there can be a lot of tensions that arise in terms of how people think things should be done. And what we at Delphi are focused on is safe, broad, affordable access to these medicines for everyone who can benefit from them. And that requires keeping an open aperture. So when we look at medicalization, which is our domain expertise, but there's also the state level therapeutic use models, there's religious use models, and so forth. We absolutely like to keep the models that we create in our mind non-exclusive to other forms of access. And that is a more complex, it takes more agility, an ability to hold complexity. And that brings me to my second thing that I'm most proud of, which is this team. And not some people out there know, but not everyone knows what it is to build a startup company, bootstrap a startup company in an emerging industry with an incredible amount of uncertainty and all kinds of complexities. And what I have seen from this team is the greatest amount of creativity, of passion, of willing to sacrifice because of this larger vision that we are all holding for how these medicines may be able to end suffering and heal suffering and shape humanity in a positive way. I couldn't feel more supported as a leader and more appreciative for the talent and the hearts that we have here at Delphi.
Thank you, Leanne. I think you're really sharing like what's the vision and how we're looking at this. And I think also more concretely, I think we're really glad to be that bridge between the psychedelic ecosystem and then the broader landscape of finance, of healthcare, of government. But I think also from my own perspective of really mapping out the research and being focused on what's happening there, also be the bridge between the research and the implementation. And I think then we'll probably talk about this more, but in the Hope Project, really looking at what are the costs, but of course also the benefits of psychedelic-assisted therapies, and then implementing that and really looking ahead, like how much will it cost and how beneficial will it be. And we have some great academic studies on this right now, but really testing it on real life scenarios and real life parts of the healthcare system with the Hope Project in the US, but we're also looking at doing this for Europe, where we have almost nothing on health economics.
Yeah, fabulous. I'm really impressed with this kind of movement from the sort of promise of what's possible to putting into the practice, Floris, the areas that you were just describing, so that there is this basis for safe and meaningful adoption. And back to your point, Leah, that we're not excluding various pathways, but we're particularly interested in the clinical mental health pathway that could lead to reimbursement and care getting paid for those for whom can benefit. And you, in the last session, first Delphi session of this round, you discussed an intentional focus on decision makers in this system of healthcare and finance and government. What drives your decision to focus on these stakeholders who sit outside of psychedelics but are in the mainstream field? And I'm recalling what you referred to in Buckminster Fuller's work about how you have to change the thinking in a field. So tell us a little bit about why the intentional focus where you are when so many in trying to move forward safe adoption are in the psychedelic swim lane. You're out building bridges.
That's really the heart of it for us right now is recognizing that we are at a juncture where there are so many decision makers. We're talking thousands and thousands of people who will need to make good decisions about psychedelics, but we cannot expect them to actually care about psychedelics. We cannot assume that they will have had a good psychedelic experience. They may even be working with misinformation, and that's one of the things that we realize anyone over 35 has been really indoctrinated with misinformation. And so what we see is as you try to get these systems, which we absolutely need, to adopt psychedelics, at some juncture, you will run into a decision maker who is operating from a fear-based information and mentality, consciously or unconsciously, related to psychedelics. And I have seen this working in the commercial health insurance industry, where my job was to get insurance carriers and insurance plans and self-funded groups to make these big decisions about, for example, adopting new coverage. And what happens is that you will get to one key decision maker and everything will grind to a halt. And that key decision maker will just dig their heels in and they'll say, no, this is not going to happen. And now we have a loss of efficiency. We have things that have moved really far down the road only to fail at the last stages. This is what we need to reduce that friction very proactively and reset those folks' understanding or motivation to make good decisions about psychedelics by appealing to their motivations. So the way that I like to frame it is in the commercial health insurance industry, I used to work to bring the legal, moral, and financial trifecta of here's just the hard facts that you, decision maker, need in a very tidy package for you to digest so that you are prepared when this decision hits your desk to make the right decision for your organization. And that's how we would love to help prime these industries, which we feel very strongly, by the way, non-advocacy education is the way to go. It needs to be science-based, fact-based, and giving decision makers respecting their autonomy to make good decisions for the organizations and what is under their scope related to psychedelics. And we also feel that if these facts and the science is presented in the way that it needs to be presented, in the, contextualized appropriately, that by and large, we're going to see good decisions made and adoption happen more quickly. So that's some of our reasoning to get going on focusing on those decision makers. I want to say one last thing is about it is so easy for us to work in psychedelics to get the bubble mentality and really think that the rest of the world is further along than it actually is. We ourselves drink our own Kool-Aid, so to speak, and see the media and say, oh, now isn't everyone on board? No, we're very far away from that, and I think we saw that. So unfortunately, come to a head at the Lykos decision, and we expect more of that if we don't get out ahead of it.
Thank you. So we're going to just talk about the state of the field a little bit, and then we're going to come back to what might we do in some of these states that are presenting particular opportunities to help build out elements of the clinical mental health pathway. So just thinking a bit about the field, right? We have many in the field have just 2 weeks out of the psychedelic science meeting. They gathered almost 8,000 people from around the world moving this forward. And we saw leaders from the American Psychiatric Association and social workers there, ranking members of Congress, Veterans Administration, even representatives of the administration there. And really importantly, seeing psychedelics there, they're being educated, I think, in a good way by groups like MAPS and the Psychedelic Science Funders Collaborative and a group of funders, this Office of System Collaborative, very interesting, Brain Futures and others. And I'm thrilled with the kind of partners we're seeing. The 1440 group and the University Psychedelic Education Program and the Psychedelic Mental Health Alliance, these kinds of organizations, the Psychedelic Medicine Association, the Safety Institute, this field is growing significantly to meet some of the things that bridge is really requiring. But the laboratory of New Mexico and tech in particular around the way they approached this, or for example, in Texas, around the new $50 million investment in Ibogaine clinical trials, these are places that I think about the guilds and others who have been a bit reticent to go all the way until they feel like the research is in place. These are living laboratories where experiments around the workforce of the future, getting the data for quality and reimbursement, making sure that the practice guidelines and protocols are being built. How do you see your role and what do you see as the opportunities in these states where the voters have spoken?
I love this question, Tyler. It is something that we have been tracking for many years in a hopeful way, and it's starting to play out in ways that we think are good for access. So let me frame this a little bit. Historically, as I've mentioned, we think about the spectrum of access as having three wedges, right? Medicalization, state level therapeutic use, and religious use. Those are all what could be considered regulated use. And it's very easy for us to get into siloed thinking. We just are going to go medicalization. We're just going to go and even competition. Oh, if it's happening over here, then it's a threat to what's happening over here. What we see, the will of the people, the will of the states, the will of the governments in these states is no, we're going to look at where these things can weave and intersect, which we feel is the best possible opportunity for access, where you can have maybe lower cost of care for people who don't have extreme kind of medical need, and also higher levels of care in the medical system, for example, for people who have more serious cases that need to be addressed in that way. And so now we start to get this full spectrum of access that also can benefit from the reimbursement systems of Medicare, Medicaid, even possibly the commercial markets. And also, it is amazing to see the states get in on the ground floor of funding research in the way that they have with ibogaine in Texas. Often we're seeing that come from the federal government, from NIH, and so forth. And so this is a new paradigm. This is a shift that it's a little bit bigger and better than I think we could have hoped. And we need to make sure that we're really considering all of the stakeholders and bringing everyone to the table as we start to shape exactly the things that you talked about. What are the standards of care? What are the standards of training? Who is doing the licensure? What patients or participants are able to access care through what mechanisms, and how is that paid for? So the opportunity here is great. The complexity is great. And I think that's really where we thrive in.
Okay. Fabulous. I just love where we are with this and what's possible. And just to name some of the other things in the states that could be possible too, but that have been our clinician self-experience and other forms of supervisory training and places to get deeper into what excellence is going to look like, that need state models like that can inform what happens. So just thrilled about that. Maybe since reimbursement's on our mind, as reimbursement's on the docket here in the United States today, maybe we turn back to Floris in Europe for a minute to talk with us a bit about some of your work, which has been around reimbursement pathways for psychedelics in Europe. And obviously very different systems, but we can't forget that the logic of state Medicaid, the logic of some big insurers, integrated health plans, runs like the logic of European countries. So there's a lot to learn from here that could be adapted. And Floris, maybe you could share some of the highlights from the recent report and what that might mean for Delphi's future work in Europe.
Yeah, I think also on the last question, in the US, there are different states, there are different things that they're experimenting with. And I guess you can also see Europe as some states together, I guess under the European Union, but of course, you have the UK and Switzerland also,
Right.
where of course some things are already happening and we can see different models being tried. And even things yeah, and even for me, came out of left field that psilocybin will soon be available for medical use in the Czech Republic. So it's amazing to see that go through, I guess, the House in the US terms. It still has to go to the Senate and then the President, but they expect it to go through. So that's amazing to see some of those things changing. Of course, the natural experiment of the unregulated use here in the Netherlands. So also, yeah, from these places here in the Netherlands, but also in the US, there's a lot to learn from what is already going on versus just only starting to learn when something gets phase 3 approval and then we can see the results after that. But what's happening here? On one hand, a lot is happening. On the other hand, we're still quite far behind in comparison to the
Mhm.
US. So as I said in the first question, like around the health economics, we have one published study that's relatively at a high level looking at the UK and what if we implement psilocybin and it's relatively cheap and then, yeah, it can be cost effective. But we don't really know how that will work. Tyler, you made the comparison with the Kaiser Permanente like programs that may be comparable to Europe, but then in Europe, there's still so many different systems.
Right.
And then NICE and NHS, that's totally different from the semi-commercial insurance here in the Netherlands. There's still a lot that also needs to be figured out how to actually implement it. And then looking at not only us just being a bit behind in figuring all of this out and working on this to see how we can have all those building blocks. But I think one big challenge, one big difference between the US and Europe, at least as how I see it, is in the US, if you have the money, then everything or a lot of things are possible, right? The healthcare system, if you pay enough to do it. And here in Europe, it's really more supply constrained. So one big challenge that I think we have to face here is the therapists that are available. And I think you also see this in the US, but a lot of therapists being burned out, a lot of therapists going out of the insured sector and starting a private clinic. So we really have to see how can we balance that request for a lot of therapist hours, at least what we see, for instance, in the MAPS or in the LICUS protocol. How can we balance that with things becoming available and being widely available? But I think if we have a amazing efficacy on the other side, I think it can also happen in the European system.
Really helpful. And well, I think, first of all, it's incredibly promising and in some places ahead in the reimbursement system and some behind. I think really important distinctions you're making there. And maybe Leah, before we sort of pivot, just we're all aware today that that Congress is looking at Medicaid cuts, et cetera. I think there's concern that some of what is being looked at here in the United States might reduce opportunity for some reimbursement and might undercut medical care access for the most vulnerable in the US in some ways that are quite hurtful. But there's still quite a system to build on. And maybe you want to speak a little bit about what you're seeing and currently in reimbursement here in the US and really what is also possible with Medicare and commercial pay and other methods in addition to Medicaid.
Yeah, thank you so much, Taylor. It's interesting, as if psychedelics weren't complex in and of themselves, complex enough. There's a lot of moving landscape with what we typically would see for the healthcare delivery system and the payer system. I want to take one quick step back. I'm going to answer your question, but I do want to take one quick step back because we're very hyper focused, I would say, on efficiency. And it's been interesting as we have done the mapping in Europe and looked at US, how much overlap there is in a lot of the content that needs to be created. So standards of care, standards of training, a lot of the things that need to get done by the field itself, how reimbursement is structured, coding, what services are included. Those are actually very much the same, very similar between Europe and US. It's just the pathways that need to be taken and the decision makers involved in creating the coverage adoption and implementing the treatment into those care delivery systems. So we think that will hopefully lead to some really interesting, possibly international opportunities for collaboration that could lend to efficiency. And regarding the changing landscape of Medicaid, I want to take a very realistic look at this, which many people probably won't realize. The first is that Medicare and Medicaid tend to be the slowest in terms of any kind of coverage adoption. You're probably going to see the commercial markets move more quickly relative to covering psychedelic therapies. And when we are talking about implementing something of this nature and this novelty into the healthcare system, we're talking about a much longer timeline than people realize that vastly outstrips political cycles. And so we as a field need to be thinking about what resources and what is the landscape that we have to work with right now and just keep the eye on the prize of access. Where are the opportunities for access right now? Understanding that those opportunities can change in the future one way or another. So it's both a short-term and a long-term view, but it's important for people to see that the changes that are happening right at this moment maybe don't even actually line up with the normal timeline of when we would expect Medicare and Medicaid to adopt this coverage.
Super helpful. This is a very interesting time. Uncertainty is the watchword of this moment. But if you had a crystal ball, where would you see Delphi in the next 3, 6, 12 months? And just what's on your horizon?
What we would really like to see in 3 months is for all of the projects that we have presented in terms of developing the economic analysis and the decision maker non-advocacy education funded, and then start to see over 6 to 12 months that analysis being done, papers starting to be published, and actually deployment of that information into the public domain with a strategy to actually make sure that the right decision makers are using that information in the most strategic and advantageous ways when it comes to laying the groundwork for psychedelics to come through in pacing with what we see happening at the FDA. Now, many of us have either watched the footage or heard about Robert Kennedy's comments to Congress about a 12-month window for psychedelic therapies to be covered. Okay, that's no time at all.
Yes. Get
That's,
ready now.
oh my goodness, like we need to be in a full sprint. And we're really poised and ready just to begin executing once all of the funding is received and all the stakeholders can be gathered. And we'd like to see a qualitative difference in the system's readiness for implementation, the system's readiness for implementation when we reach those coverage decisions.
Floris, in your crystal ball, or maybe in your aspiration. Yeah.
Totally agree with what Leah's saying. And then maybe just to focus here on Europe, it's not even per se having all of that executed in the next few months, but really having that roadmap really mapped out in way more detail. So we have a roadmap, we have these are the pillars that we need to be working on. And for instance, for health economics, like we really do know what we exactly want to do. But then starting from next year, getting that work going and seeing how do we both catch up to the US, but also make that implementation roadmap happen specifically
Mm.
for Europe. So then
Yeah.
if you're okay with it, Tyler,
Yeah,
let's
let's do.
turn it around a bit. First, I think a question for everyone from Melody, and that is, do you think new CPT codes for psychedelic preparation, dosing, and integration should be developed and should be based on the type of psychedelics used for care?
Yeah, I think that question can be answered over time. And it is a bit of a chicken and the egg because what you want to see is you want to see the system willingly adopt this treatment. And sometimes that means using what are called orphan codes or existing service codes in order to expedite those services being available and being reimbursed. In what you're asking, creating novel codes, novel CPT codes, and the more specific you get, medicine related, et cetera, now that becomes a burden within the system, that becomes a heavy lift. And so the system actually needs to see the reasons why going through that exercise, everything from
Mhm.
creating the codes to then going back and retooling all of the claim systems and
Mhm.
all of the provider contracting. It's just a huge, massive effort when those new codes are developed and implemented. I think that for psychedelic healthcare in general, we've already seen a new code set developed by Lycos. That was a temporary code set, which is always the first step to these types of new codes, and then work by Brain Futures. So it's happening. The degree to which it needs to be at the level of granularity that you're suggesting is to be determined. And we really want to find that sweet spot between what works for the system and what works for the providers and the well-being of those who are
Yeah.
offering the care.
Just because that was such a comprehensive answer, I think it was so, I'm going to build on it from a different direction because a
Yeah.
big ditto to much of what you said. We don't even have CPT codes for a pediatrician to talk to a mom and their kid about their mental health issues. That's the state actually of the ability to do reimbursement for clinicians around care. So I just want to say that why this work by many of us, including some of those on the call with the mainstream field, is so important as they work to make sure that insurance is paying for mental health care in general and that clinicians are being paid in general for mental health altogether, not only for these novel therapies. So, just a reminder that as we join forces with the broader field, they are looking at how we're making access these codes available for reimbursement altogether. So we want to make sure we're understanding in the psychedelic field where our partners are, and that the more successful they are in actually having billing codes, we will be more successful, to Melody's good question and your response to that. So that's what it looks like to play in a bigger field.
So given the exciting attendance of both APAs and NASW at Psychedelic Science 2025, Have they also shown interest in leaning into help developing standards of care and standards for training and accreditation?
First of all, and Jeremy, I just want to start off with the excitement in the field about what Saba's doing and the partnership with the University Psychedelic Education Program. And when I showed some of what you were up to the CEO of the American Psychiatric Association, she was so thrilled. It was like, this is what's been needed all along. So I just want to acknowledge that the way that partners like you and Inside 1440 and the of system catalyst, it's really mattering to build the infrastructure that would allow the guilds to come along. So back to the core of your question. Dr. Marquita Wills on the stage at Denver was very clear. We need to be ready for rescheduling. And that's pointing to the very things that Leah was just talking about, how we make sure that those practice guidelines and the protocols and what standards of excellence look like, they see that they have a very key role in that. Obviously, there's a lot of work that needs to happen with states. The specific work that's following up to that, which is probably the curiosity of a lot of people here, because obviously it was so exciting and the announcements and everything 2 weeks ago, is that the senior staff inside those guilds who have been working on safe, equitable access to psychedelic assisted therapy for all who can benefit are now getting more light shined on their work. They are connecting with each other, not only inside the guilds, but across the guilds to be ready for this. And so I would say that there was a big excitement to have those key professional association leaders there. But what it really did, not just the symbolic, it's bringing the senior members of their teams into action to get readiness, building on the work of psychologists and psychiatrists and social workers and psych nurses and chaplains and others out across the field. So I think we're in a really extraordinary kind of position for those standards for training and accreditation to be built out. Good question, Jeremy.
Thank you so much, Tyler. Then a question from Julia. As industries like energy and agriculture face increasing demands for environmental and social accountability, and particularly regarding impacts on indigenous communities, how prepared is the medical field to advance research while properly acknowledging and respecting the rights of indigenous people whose traditional plant medicine knowledge forms the foundation of much current pharmaceutical research?
I'm happy to start with a small piece here, and then Leah, only because I can speak to what was said both by Dr. Marquita Wells, the CEO of the American Psychiatric Association, whose opening comments had to do with respecting the medicine and indigenous wisdom of our indigenous communities and the deference to hundreds, if not thousands and thousands of years of working with these plant medicines, not only in their interaction with the individual, but also in community and peer settings and community settings that are capable of not only spreading healing, but making not only individual, but family and societal and cultural changes. And Julia, I just love your question so much because it goes to what I saw Dr. Wills really leaning into. And then when Dr. Anthony Estreet from the social workers gave his talk on the Friday morning, he was followed by the Indigenous Medicine Conservation Fund putting out the declaration and was acknowledging as he closed that social workers are used to taking a whole person, whole community view, spirit, mind, body, whole ways, but that if we really wanted to do it right, we need to be looking at the wisdom of indigenous leaders and indigenous communities around that. So how prepared are we, Julia, to your good question? I think it better be a big pebble in our shoe to make sure we bring that along. But we have signals of the deep respect and understanding of what our indigenous medicine communities have to offer here. And we're wise to be paying very close attention and be learning in partnership and also be making sure that we're doing no harm to the religious use pathway.
Tyler, that's awesome. That's awesome insight. And I think that I'll take it as you did before from a little different angle. So when you say the medical system, there's a lot of different parts of that, right? And so the signaling that Tyler is speaking to is coming from the hearts and the minds of the people who are leading as clinicians. And that is where I think a lot of the energy for upholding this ethos is going to reside in the beginning. Just in my experience, the system itself is always looking for things to be streamlined and less complicated And the mystery is not streamlined, and it is certainly complicated. And having indigenous wisdom or sacred, I think that sometimes that there can be a resistance inside of the system that is just in a rush to create efficiencies of scale and have certain economic returns and so forth. That's the built-in bias. What Tyler is sharing is so very important, because if we're going to shift the zeitgeist around that, we're actually going to need to bake that into how we set up the rules that the system adopts. And the will to do that will need to be coalesced within organizations and with individuals to reach a critical mass and make sure that there is a way to translate to the system what is actually desired, what is actually right, and in right relationship. And this is something that has been very close to my heart for some time, doing this weaving in a wise way. And how do you get the system to voluntarily adopt what is foundationally like a shift in cosmology? It's fascinating, it's critically important, and thank you so much for the question.
I think that's all the time we have today. So Leah, would you please say when the next session is? Thank you everyone for joining today.
Thank you both so much. Let me start right there. Thank you, Floris, and thank you, Tyler. This was just as we had hoped and expected, and even better. We really appreciate you infusing your good questions and your wisdom into this conversation. So thank you for your time and your intelligence and your goodness in this conversation and in the world and in the field in general. And thanks to the audience for being here, for all of your good questions, for your interest in our work. We're always happy to field questions offline. And the next Insight session, our third, will be in the month. It's always the first Wednesday of the month.
Yes,
So
August 6th.
which will be August 6th. So we look forward to seeing you back here then. And in the meantime, have a wonderful Independence Day and a happy summer. Thanks, everyone.